I'd like to introduce you to our unique approach to cancer care. When we are diagnosed with cancer, we are seen by a medical oncologist. This is the person who prescribes the drugs to fight disease, and the medical oncologist is the captain of your ship. Medical oncology refers to surgical oncology, who will remove the tumor if possible. Medical oncology also refers to radiation oncology, who will radiate the place where the tumor was to make sure nothing is left behind. They may also use radiation to spot treat places where there is pain or new tumor growth. If you are fortunate, the cancer center you are at also has a dietitian and a social worker, and some other specialists to round out your team. However, at Associates of Integrative Medicine, we believe this basic model is not sufficient to treat cancer at its root. In working with thousands of cancer patients in both hospital and outpatient settings, we have seen an integrative oncology approach to be the most effective approach. With an eye to treat the root cause, we designed a truly holistic model in which oncology also refers to someone like ourselves who has the letters FABNO after our names. These letters stand for the Fellow of the American Board of Naturopathic Oncology. Our technical title is Integrative Oncologist. Other terms you may have heard are Naturopathic Oncologist. We call ourselves Supportive Care Oncology Providers. A FABNO is someone who has, in addition to completing a doctoral degree in natural medicine and an expanded family medicine residency over 2,000 clinic hours, done a 5-year postdoctoral degree in a hospital setting as an oncology provider, or a 2-year based hospital fellowship in an oncology setting. These are just fancy ways of saying FABNOs are highly trained in working closely with medical oncology to choose the right natural therapies for your specific disease, make sure there are no negative interactions between your conventional treatment and your natural therapies, choose natural therapy options that are safe, have evidence that they work, and are cost effective. We are called Associates of Integrative Medicine because we have expanded the current model of care to include other associates. Integrative Oncology. So these are FABNOs who recommend supplements, minerals, vitamins, hormones, botanicals, off-label drugs with evidence that they work in the fight against cancer, and IV therapies, which prevent the side effects from chemotherapy, targeted therapy, radiation, and help to optimize surgical outcomes. Chemotherapy and radiation can have both short-term and long-term side effects. Our job is to design individualized plans to prevent or lessen these using natural therapies. Our goals are also to choose from the natural therapy world what has the best data that it'll fight your type of cancer when partnered with your type of conventional treatment. Once we are done with treatment, a FABNO's job is to lower the risk of recurrence, or if we must continue, slow progression, so that our patients can live the longest, healthiest lives possible. This may include referring to cardiology, endocrinology, and gastroenterology, all of whom are partnered with AIM and work extensively with cancer patients. Supportive care providers then refer to nutrition. Our oncology nutritionists are FABNO candidates and doctoral level specialists in how to use food as medicine. They are not dietitians. They don't take the approach of counting calories, prescribing formula feeds, or isolating macronutrients. They are nutritionists who have worked solely in cancer care, and their job is to design individualized nutrition programs to fight your type of cancer, lower risk of recurrence, and slow progression. We keep the wheel moving by referring to oncology mental health. 46% of people treated for cancer struggle with PTSD, almost 85% with depression, and almost all with anxiety. Oncology mental health at our clinic is staffed by master's and doctoral level providers who see almost exclusively cancer patients. Their job is to shepherd our patients and their families through this journey, and they can meet in almost any setting: telehealth, at home, once a week or twice a week to work through grief, sleep disturbance, panic, loss of identity, life changes, spiritual anxiety, changes in our marriages, and fears and concerns about our health. Oncology Mental Health also runs monthly groups to manage grief, stress, caregiver issues, and cognitive fog. Our mental and emotional health is critical in our fight against cancer. These specialists have specialized training in trauma, including mindfulness based stress reduction, which includes yoga, meditation, and breath work, and has the strongest data on being effective for symptom relief, and which conclusively helps recruit the immune system in the fight against cancer. In turn, oncology mental health is also referring to physical therapies. By this, we don't just mean traditional physical therapy, we mean somatic therapies. Therapy that helps us to reconnect the mind, spirit, and body. At Associates of Integrative Medicine, we use art therapy, music therapy, massage, Reiki, biofeedback, infrared to not just calm the mind, but to activate the body's internal mechanisms for healing. The wheel may split off to include storytelling and home care if a person is in a transitional part of their journey on this earth. But that is an individual, private discussion between the doctors, the patient, and their caregivers. And those services are entirely personal and rarely necessary. Our hope is that the wheel keeps turning with the patient at the center. Because just as we said at the beginning, oncology is the captain of your ship. You can think of all of your other providers as crew, but you own the boat.